Hello, good afternoon, ladies and gentlemen. Nice to meet every one of you here in our Facebook Live. Every Wednesday, we will be meeting here, with every one of you. Okay, thank you for joining our live here. And it's our time again to share more informations and to explain more information to every one of you. Looking into better well-being, also healthier life. Okay, more beautiful outlook, and also of course, more quality health in your body. Okay, so as we understand, okay, nowadays a lot of people are getting diseases easier, and also in a younger age, especially a condition with diabetes is getting more frequent or more commonly seen in younger people. So, and as we know, once you got diabetes and once you got start taking medication, the purpose of medication is to control your diabetes so that the problem would not progress fast and to prevent the complications that the diabetes cause. But the thing is, taking medication, is it really can slow down your diabetes if you do not take care of your lifestyle, if you do not take care of your food diet, and if you are in an obese condition, if you do not also reduce your body weight, and if you do not really change your bad behavior in your lifestyle, sometimes like alcoholics, smoking, okay, all these are the contributing factors that causes the diabetes to progress easier in the body. Okay, so how to improve the body so that it won't progress fast if you can't totally change the lifestyle, and also if you are able to change but you want your diabetes condition to recover to a better stage, which possibly go to pre-diabetic stage, okay, and also possibly to reduce the need of medication or even stop the medications. What are the chances or what are the options that you can also do to improve? Okay, here is our objective today. We will be talking the role of stem cells in diabetes treatment, and how to treat diabetes treatment in a more regenerative way, which is actually treating the root cause of diabetes. And what is the root cause of diabetes? Yes, we will be talking about the root cause of diabetes. And today we will also explain to all your doubts regarding diabetes. Probably a lot of people misunderstood what is actually a diabetes problem is. And we will be, hopefully today we will have the chance to explain to you all the root cause of diabetes and what is the role of anti-aging or regenerative medicines. And of course, the most famous one is stem cells. What is the role of stem cells? Yeah. So I welcome again to everyone here in our live. Thank you once again that every one of you willingly to join and to discuss about this topic. A very interesting topic that I actually have been thinking to share to every one of you for a long period of time. And today, finally, we got a chance here to share this information. Yeah. Okay, let us begin. Ladies and gentlemen, if you do have any particular questions here, you are welcome to key in your comments, your questions in the comments, so that I can answer precisely to your problems. Okay, so my objective here is to let every one of you to have the chance to understand the diabetes better, and to also understand better how regenerative medicines play the important role in the diabetes treatment. Okay, compared to medication. Today, we are not talking about medications. We are not talking about new medication. We are talking about how regenerative medicines roles in the diabetes management treatment. Okay. Yes. Welcome, Sok Mei. Okay. Yes. Hi. Okay. Thank you for joining. Yes. Okay. Today, our focus point will be more focused or precise onto diabetes. Okay. And along the way, we'll be talking about diabetes. And of course, we'll be bringing in what is the role of regenerative medicines in diabetes. Okay. So let us begin. So, okay, first of all, probably you can understand a little bit more first. Okay, what is actually diabetes? Okay. So diabetes is a condition where when our insulin functioning in our body become resistant, and when it reach an advanced stage of insulin resistance, means whatever insulin produced from your organ called pancreas here is not functioning anymore, then your metabolism of sugar in your body will become deranged, non-functional or malfunctional. The advanced stage of this condition will create or will start to have this condition called diabetes. Simple to say. Okay, for your understanding first, diabetes is a condition when your pancreas is exhausted, okay, not functioning well in producing functional insulin anymore. Okay, so pancreas is responsible for insulin production. Okay, ladies and gentlemen, so today if you are new to all these words, okay, you just need to understand or get to know what is pancreas, what is insulin first. Okay, pancreas is our organ in our body, one part of our organ that is responsible to produce insulin, and the role of insulin is to help our sugar metabolism in the body so that it control the sugar level in our body in a normal range. Okay, what happens is if the insulin production from the pancreas is not working well, so what it will be causing is actually the insulin will be having will be in a character of resistant behavior. So means your pancreas has to compensate, automatically has to compensate by producing more insulin. In one sense, the insulin overproduction characters in the body will make the pancreas become overloaded in the workload. And for long run, actually, it will be exhaustive to the pancreas, and your pancreas slowly will be more and more difficult to produce good insulin. Okay, and along the way, if the insulin produced from the pancreas is still not functioning well, which we call resistant, then the pancreas has to be still adding on OT, OT over time, overloaded. Okay, then have to produce more and more insulin to compensate more and more insulin resistance. So this is a vicious cycle. It's a bad cycle. It carries on. When this condition of the cycles carries on again and again, years along year to year, okay, until at advanced stage where your insulin resistance is very worse at the level, and your pancreas is no more able to produce any functioning or sensitive insulin, that is where your diabetes stage started. Okay. ladies and gentlemen, okay, this is, we call it type 2 diabetes, which is more on the aging characters, or when we getting older, okay, then due to lifestyle, due to overall environmental factors or your diet habits, okay, so it causes this aging and damaging of your pancreas to carry on slowly over time. So compared to another type of diabetes called diabetes type 1, or we call it insulin dependent diabetes. It's actually, we call it more on genetic reason. Okay, today we were not talking about that part. We will be talking more on the non-insulin kind of dependent. So which is the type 2 diabetes. Okay, so ladies and gentlemen, so far everything's clear. If you are not clear, you can always type in your questions here. Okay, so just now what I was talking about is just a brief idea about how the progress of the diabetes and how it forms. Okay, so today our focus still will be talking about more on regenerative medicine's role in diabetes. Okay, again, before we step into this main focus, let us see whether do we have any characters of insulin resistance in the body. Okay, I put it simple for every one of you. If you would like to self-assess to see whether your body do have any level of insulin resistance, which is the early stage of not diabetes, is early stage of your pancreas exhaustion. Okay, if you are having early stage of insulin resistance, you probably having some sort of some sense of craving for sugar food, or tasty sugar food. If you are always craving for, like, let's say sweet food, or sort of like more on sugary food, okay, then you probably having a certain degree or significant degree of insulin resistance in your body. Why? Because when your body has insulin resistance, your pancreas will tend to produce higher insulin to compensate. In this sense, actually, whenever your body tasted a little bit of sugar, it will actually stimulate your pancreas to suddenly produce a lot of insulin. In this sense, your insulin will be always on the higher side. And when you have higher insulin, you tend to crave for sugar, and also you can't bear with the starvation. You can't starve. You can't do intermittent fasting. You just cannot bear the starvation. You feel hungry and you feel very uneasy when you're hungry. Okay, so this is the earliest sign of insulin resistance. Okay, if you're also having a low immune strength, okay, which means you have some inflammation characters, it is also a sense of insulin resistance. Okay, usually will present as in like dry skin, sensitive urticaria characters, sensitive skin with mild eczema or mild to moderate eczema characters. And also you probably have some inflammation characters in the sense of you feel tired, okay, you feel difficulty to sleep well, your emotional disturbance is significant, okay, and you get cold, or you get cough and flu very easily, okay. Yeah, so all these are the signs of inflammation, okay, may not be very significant, but is actually indicating that you have low immune system, which is directly related to insulin resistance. Okay, so you may self-checking, see whether if you do have recently, let's say if you been taking regularly taking ice cream, taking some breads, sugary food lah, okay, then you probably you feel that these few days you are more craving, and also you can't stand with the starvation. Once you are on time, you want to eat certain, you can't delay your lunch, you can't delay your dinner, that kind of feeling. And you feel when you sleep, okay, you feel you can't sleep well, your mood quite disturbed, okay, and also you probably having some dry skin, itchy here and there, or maybe some eczema problems which has been cured long period of time before, then now it's slowly coming back, okay, then you don't know why, okay, then you can lovely guess and lovely know what's the reason, okay. Sorry. Okay, so how about when the progress of the insulin resistance goes to the higher stage? What will happen? Okay, your body was starting to develop some amount of visceral fat, which is in-organ fat. Okay, where you starting to have some tummy. Okay, and you will get a little bit of spare tire here, okay, and you probably have some double chin, okay, yes. So in this case, your visceral fat is collecting, and probably you are facing some difficulty to lose weight, or your weight is actually gaining a little bit more, okay, 1 or 2 kilos, 3 kilos, which compared to you used to be maintained in certain amount of level of weight, but then suddenly increased 2 or 3 kilos. So this is a sign of insulin resistance here also. And if you always have some gut discomfort, for example, you feel some gastric, some bloatiness of your stomach, okay, sometimes your passing motion is not as regular, sometimes your stool is too hard, sometimes your stool is too soft, sometimes you got a bit diarrhea, okay, then the leaky gut characters is slowly kicking in when your insulin resistance is building up, okay. And yes, of course, weight gain is related to visceral fat. Okay, so middle stage of insulin resistance is quite significantly seen usually at the middle age, roughly about 40 years old, 35 to 40 years old. Okay, and sometimes even can start as early as 30 years old. Most of the time, 35 to 40 years old is when this condition slowly start. You may not noticing, you may not be noticing it, but then when you're reaching about 40, 45, this thing will be more significant, which already damage has done. Okay, so this is the characters. Okay, all right. So when you reach a later stage, which is even more significant insulin resistance in your body, yes, then you slowly will have more significant symptoms, which a lot of people were starting to have lower energy level in the body, and the sexual drive will be weaker, and they probably have borderline sugar level, which is near to diabetes, and also when they have also some high cholesterol, and also starting to have higher blood pressure in the body, okay. And of course, it comes together with the previous symptoms, craving, okay, low immune system, okay, allergic issue, all right, and also gaining weight, okay, gut discomfort issue becoming more frequent, okay. So all these are the changes, the progress of the insulin resistant characters over time, okay. But basically, insulin resistant is quite hard to measure in our routine blood test, okay. You can either see your blood sugar level at the borderline, which already means you are on a later stage of insulin resistant, or if you want to do a blood check on your insulin level, yes, you can do, where if you found high insulin level in your body, okay, especially after food, okay, but whether you need to interpret it accordingly lah, okay. And also if you always has these symptoms, okay, together with those blood test result, then probably the chances to have high insulin resistance in your body is there, okay. So why we are talking about insulin resistance, okay, is isn't it our topic today is talking about stem cell regenerative medicine, okay. Today we are talking about stem cell and regenerative medicine's applications, the use, the role in diabetes treatment. By understanding this insulin resistance level actually helps you to self-checking whether how soon should you start taking care of your pancreas, reducing your insulin resistance. And by this stage, usually you do not yet need any medication for diabetes, but you need anti-aging or regenerative treatment so that your pancreas will not progress to become exhaustive, and you will not progress so easily into a real diabetes stage. Okay, so this is why I'm talking about all these topics to you. Okay, so once you get into more and more developing of your insulin resistance, okay, most commonly seen factors that some of it you can change yourself or modify in your lifestyle, some you may not. For example, aging, you can change aging, right? Okay, of course, but you can do something to improve your overall cells well-being, okay, delay the cells aging, okay, your body cells aging, and also if your insulin resistance persists, if you notice those symptoms as I mentioned just now, and you do not do anything, and you let this condition progress and persist, then slowly the pancreas cells will age faster and become more damaging, and you will progress into diabetes even faster. And of course, if you do have visceral fat and you are on an obese or overweight condition, and you do not do anything to reduce the visceral fat, then this weight reduction will not be successful in one hand, and of course you are actually possibly higher risk of getting your diabetes aging faster than you're supposed to be. Okay, and if you have leaky gut condition, okay, always have gastric, bloated, constipation, of course your pancreas will be weaker. Then you will progress into a diabetes stage earlier. Okay, if this is not changing. Heavy smokers, yeah, and also regular smokers, high liver toxics, especially coming from alcohols, yeah, it also can contribute with the rest of the factors to contribute to speeding up of the pancreas aging. Okay, so all these factors, some are modifiable, some are not modifiable. Okay, the role of regenerative medicine in diabetes treatment is to focus on pancreas rejuvenation by reducing, the contributing factors that causes the pancreas damage or aging. On the other hand, also to regenerate the pancreas cells so that it grows back, become healthier characters on your pancreas, and also simultaneously reduce the workload on the pancreas. Yeah, there are techniques that actually works on different angles of this. Either you reduce the workload of pancreas, or you rejuvenate the pancreas, or you reduce the damaging factors on your pancreas, and all this will help your pancreas to rejuvenate, and then, regenerative medicine will be very useful to treat your diabetes condition here. Okay, so these are the long list, okay, of methods for your pancreas rejuvenation. Let me enlarge it to share to every one of you. Okay, of course, intermittent fasting, okay, or ketogenic diet, or both of the diet habits actually reduce the workload. The aim and the direction is to reduce the workload on your pancreas, increase metabolism on your basal metabolism rate, using exercise, HIIT exercise, and also thyroid optimization using bioidentical hormones, as I always been mentioning in my previous sessions of life. These are also helpful to increase your metabolism and reduce your visceral fat, okay, and increases the insulin sensitivity level in your body. Okay, visceral fat reduction by thyroid optimization, and also reducing the leaky gut syndrome, okay, will be able to reduce your visceral fat in the body, which simultaneously will help you to reduce weight and also reduce the inflammation characters from your visceral fat. And at the same time, okay, visceral fat reduction, can reduce a lot of inflammatory response that causes your body to have low immune system. Okay, and also it reduces the risk of getting hypertension and high cholesterol problems. Okay, leaky gut syndrome improvement can use diet modification, including intermittent fasting, low carbo or sugary food, okay, like ketogenic diet, okay, or you can even take enzyme supplement with probiotic supplements, to reduce a leaky gut condition. Okay, inflammatory reduction, targeting onto reducing inflammation radicals in the body using like turmeric, which is a essence of curcumin, coenzyme Q10. There are many more. NMN, which is to rejuvenate your telomeres in your body and also reducing the inflammation response, okay, in your body. There are many, many more nutritions or supplements that are helpful to reduce the inflammation, but standalone treatment will not work. Okay, if you are focusing on pancreas rejuvenation, you need to combine all the treatments together here, as many as possible, okay, as precise as possible, so that your pancreas rejuvenation will be the more effective. Immune system enhancement, okay, using NK cell therapy is one of the techniques to improve your immune system, reducing your inflammation in your body. Liver toxic reduction, of course, we need to modify the diet, and you can also take some supplement, like milk thistle is one of the good supplement to improve liver toxics. Okay, exosome therapy as stem cell therapy is the rejuvenative treatment that actually rejuvenate and regenerate the cells of your pancreas. Okay, so all this comes together. We need to plan. We need to tailor the treatment to everyone, different characters of diabetes, different lifestyle, different body conditions. Okay, accordingly, then only you will see the effect. Okay, you see, none of the mentioned topics here are about medication. Okay, so you see, the problem of taking medication here is it does not solve the problem. It does not even sort of like improve the pancreas behavior along the time when you take the medication for diabetes. It just sustain it, slow down the progress of your diabetes, but it will not make it even better. Okay, so rejuvenation of pancreas is very important. Usually it's encouraged to work together. If you are already in a diabetes stage of condition, you still need to take some medication, but with some modifiable techniques, okay, combining with this pancreas rejuvenation, what you are benefiting is actually you can sort of like reverse your diabetes stage from to lighten the stage from, let's say, if you have a severe stage, uncontrollable stage, become more controllable or become pre-diabetes stage characters in your diabetes. Okay, so this is how the regenerative medicines come into the role of diabetes treatment. All right. So, ladies and gentlemen, yes, are you so far okay, every one of you? Okay. So today's focus, we will be talking a little bit more about our main items of regenerative medicine. First is about stem cells. Second, exosomes treatment. Number 3, NK cells treatment. And of course, number 4 will be on bioidentical hormone optimization using, especially, there are many hormones that we can optimize in the body. One of the most important one that actually targeting on diabetes will be on thyroid optimization to reduce your visceral fat. Okay, ladies and gentlemen, so far clear. I don't see any questions on the comment. So I just carry on. Okay, so you see, one of the factor in diabetes or pre-diabetes condition is where our metabolism rate in the body is reduced, slow down, either due to aging or either due to sedentary lifestyle, lack of exercise, or aging, lacking of muscles, muscle depletion, and also when you age, your cells metabolism will be automatically become weaker, poorer, or slower in metabolism. Okay, all these are contributing to higher chance of developing insulin resistance if your diet habit is not modified accordingly. Meaning to say, when you are reaching 30, 40, 50 and above, and you are still taking high sugar food, then your workload on your pancreas is increases. Then compared to another output of your metabolism is lower. Then in this sense, your pancreas are actually overloaded more and more over time. And over time, your insulin resistance will develop, and then slowly it will starting to develop or build visceral fat, inflammation, and insulin resistance as a vicious cycle. So the role of optimizing your metabolism here using bioidentical hormone, especially thyroid, is to focus on increases your metabolism rate as a baseline, and also, okay, reduce your visceral fat production. Reducing visceral fat production will be very beneficial for reducing cholesterol, especially bad cholesterol, and also preventing the fatty livers, and of course a lot of blood vessels blockage. Okay, literature studies shows a lot of contradiction proof into thyroid optimization. So thyroid optimization here is to talking about thyroid level near to younger level, which is still within the normal range, and it's not hyperthyroidism. Okay, so in this sense, it will benefit a person to improve the basal metabolism rate by having those benefits of reducing visceral fat, reducing cholesterol, and also blood vessel block, and increases the metabolism in the body, increase energy level in the body, and reduce insulin resistance. So all these are the benefiting advantage, okay, that we can actually benefit from by bioidentical hormone optimization. But of course, here I would like to advise that these techniques has to be done under a proper guidance of medical professionals. It's not by your own self, any supplement that you can take. Okay, so one of the technique that we usually will do is by guiding on using a blood test, okay, to see your level and guide your level, okay, to make sure you are tolerable well and you are achieving the optimum level of your blood hormone level. And of course, your symptom, your feeling accordingly is actually has to be monitored. Yeah. And of course, bioidentical hormone, why we mentioned bioidentical hormone, we want some hormones which is similar to our own body, which is not any chemically different, so that you do not need to suffer or face any chemical side effect. And as long as the level is within the acceptable or optimum level, then you will get the benefits most. Okay. So, ladies and gentlemen, of course, bioidentical hormones optimization, not only thyroid, in a ladies or any menopausal ladies, we also simultaneously optimize on the female hormone like estrogen, progesterone, DHEA, or even testosterone for female and also male patient. Okay, DHEA also a very important hormone for both female and male. Okay, so bioidentical hormone optimization will improve your baseline fundamental characters of your overall biological and also biochemistry environment in your body, so that it preserves a good environment for your cells to live in, and then it helps your body to keep in a better behavior. It helps you to improve your overall well-being. It also reduce the aging of your cells, okay, in your body. Next, okay, NK cell therapy. Yes. So NK cell therapy does not really directly straight to the point that treat diabetes, but it helps you to improve your immune system or inflammation characters in your body if you have high insulin resistance. So actually it clears some damaging cells or aging cells in your body. So it actually create a path for the subsequent treatment like exosome and also stem cell treatment to comes in. And also NK cells make your body clearer from all these unhealthy or senescent or the aging cells, so then your body will be able to benefit better, okay, from exosome treatment, from stem cell treatment, or even from bioidentical hormone optimization treatment. Okay, so as we discussed NK cell treatment lovely about 2 or 3 weeks back, and also we also have a live TV talks about NK cell therapy in Living Delight show in Malaysian National TV, 8 TV. Yeah. So if you are willing to view back our show in this 8 TV Living Delight program, yeah, you can always click the link below as we will share later. Okay. So NK cells is not only helpful, okay, to reduce inflammation and reduce the aging cells. Okay, basically it has a lot of benefits. Yeah, it can improve your cells environment, so that if you also doing hormone optimization, it improve environment of your cells, and also it give your cells more or lesser the aging cell. It give your body remaining more healthier cells to regenerate or to work in a healthier and cleaner environment. Okay, so this will prevent a lot of diseases. Okay, yeah, not only delaying the progress of diabetes, NK cell therapy actually also prevent a lot of autoimmune diseases, also reduces a lot of other aging diseases. Okay, and also NK cell is also very helpful to reduce the risk of cancers in the body. Okay, so NK cell is very interesting because it's one of our biological ability, which we do have the ability, but the disadvantage is everyone when we are aging, our body will slowly weaker in this NK cell ability, which your cells are becoming less active from, and your immune system and the ability of your NK cell to clear off the unhealthy or aging cells is becoming weaker over time. So we can do culturing autologous NK cell therapy to reactivate and to reculture a better number of NK cells, so that this higher number of activated NK cells will help our body to clear off all the aging cells in our body. Okay, so that will prevent all these unnecessary aging diseases like cancers, the autoimmune diseases, and also make your environment better. Your body will feel younger, more energetic. Okay, yeah, all these are the benefits of NK cells. Okay, most importantly is for you all to understand the idea of a treatment, but when it comes to the treatment choice or how to do the treatment, it actually has to tally and also tailor to everyone's different individuals' problems per se. Okay, so all right. So next, exosome treatment or exosome therapy, as we have discussed before, is actually quite new in the not really new in terms of the research and study, but in terms of the usage in the market or in medical line is still quite new. Okay, so exosome therapy has a huge advantage, especially as a cells to cells communication to promote better cells to self interaction and overall metabolism or also cells to cell functioning. So exosome will promote better cells to cells functioning communication. So in terms of how it works for this diabetes, okay, so exosome actually helps to improve the healing of your pancreas. You also improve cells to cells functioning to reduce your insulin resistant behavior. It also makes your thyroid optimization or hormone optimization becoming more functioning more effective. It also reduces the inflammation characters. If you're taking supplement, you will feel better and it works better. Okay, and it also helps your body, okay, to reduce, especially the leaky gut condition. Okay, so exosome therapy is not a cells therapy, but it is a kind of cells to cells communication messenger. So this exosome is harvested from stem cells, and in this sense of exosome, we can actually, using the advantage of more precise amount of exosome, more accurate or more, we should say, more determined dosing that we want of the exosome to really, okay, do the works of regeneration and communicating our cells in the body to make the cells functioning in the optimum way. And exosome therapy has very strong anti-inflammatory response and also pain reliefs. So it reduces a lot of exhaustion, pain, uneasy or weakness on your muscles, things like that. Give you a better well-being feeling. Okay. Most importantly is the inflammation characters. These anti-inflammation characters actually indirectly and directly, both actually helps you to reduce the insulin resistance. Okay. So exosome therapy, I would say, a very good breakthrough in our technologies in regenerative medicine. Why? Is because it gives a chance for us to make the stem cells works better. It also gives a chance to a lot of younger or middle-aged person to start doing this treatment before they step into diabetes. The stem cell treatment, and it also makes the stem cell treatment more workable or more effective in a sense to get the body more ready for the stem cells treatment. And it also complement with the rest of the medication or supplements. It helps you to respond better. Okay, so these are the role of exosome treatment in the body. Okay, how about stem cell therapy? Okay, some sharing about stem cell therapy. Okay, stem cells actually is to regenerate or heal or whatever exhausted or damaged cells in the pancreas. Once the pancreas cells become exhaustive, damaged, or aging due to overloaded insulin resistant and overloaded sugar intake, then your pancreas will slowly become exhaustive and couldn't able to produce insulin anymore. So these are the characters of the way the diabetes form. So stem cell treatment is actually the cells will be able to regenerate and to rejuvenate your pancreas. Okay, so with combination with exosome, it works better. Yes, yeah. With combination with NK cell, it works better. Yes, okay. So bioidentical hormone optimization, reduce inflammation, reduce visceral fat, and the stem cell treatment will also works better. Okay, so stem cell treatment. Okay, some sharing. There are actually some. Okay, here I listed. Yeah, maybe I can show. Okay, how to have a good selections of stem cells. Yeah, in our mind, actually, there are many sources of stem cells in is available. Okay, what are the criteria that we will be looking on the selection of good stem cells? first we will need to make sure the source, the source can be either the lab as to be a GMP lab, okay, good manufacturing, this kind of certificate lab. And of course, we need to make sure and also get to know what is the source of the stem cells is from. Commonly used now is either from a water jelly, we call it coblet, is the umbilical cord, okay, one of a kind of source. It can be also from cord blood itself, which is beside the cord can produce stem cells. The blood inside the cord or umbilical cord also can be produced stem cells. Another commonly used is fat-derived stem cells. And also there are many others, which, for example, bone marrow stem cells. Okay, yeah. So, but current commonly used stem cell source nowadays is water jelly or umbilical cord stem cells. So the stem cells viability, the processing in the lab is very important. Yeah, if it is coming from a good quality labs, is what we are looking for. And culturing process is also one of the factors that we will be looking at. If the culturing process do not use any growth factors, if the culturing process is using a very conventional techniques which do not feed the stem cells with growth factors, it actually helps the growth factors to survive better when it's actually injected or infused into the recipient body. Okay, so this is what we are looking at on the culturing process. Okay, stem cell driving, when the body is when the stem cell is infused into the body, the driving can be done using some technologies, okay, like laser, low level laser therapy, even some sound wave therapy, some electrostatic therapy, okay, some ultrasonic therapy. Yeah, all these are very beneficial to drive the cells to work, okay, to stimulate the cells to work and to drive the cells to work at particular areas of the body if you want. So treatment execution is also very important, how to carry out the stem cells infusion and therapy. For example, how to inject stem cells into a specific areas, into a joint, into a specific area of the body. Okay, also one of the key factor to determine the functioning of a stem cells. Meaning to say, if you have a good source of stem cell but you couldn't use it properly, then it's not using it, is a waste, right? Dosing and frequency of the treatment also very important. Okay, dosing and quality of stem cell, we need to have a balance. Good quality, good dosing, of course, is the best. Yeah, a little bit compromise in quality, let's say passage 3, passage 4, passage 5, yeah, but in good dosing, good number of cells, still acceptable. Okay, if you have passage 2, passage 3, yeah, of course, the early passage, the better exosome production from a stem cell, the better stem cells viability, the better regenerative power of the cells. Of course, it's a higher or better choice of stem cells, and of course, higher number of good quality of stem cells, is of course a better, right? Okay, so these are the criteria point that we are looking at whenever we select the stem cell treatment. Okay, stem cell treatment, it works to regenerate, okay, your body's damaging cells. For example, in pancreas, you also reduce inflammation response, workable together with exosome and NK cell therapy to improve, okay, your overall well-being by reducing the inflammation characters and then improve your immune system. And of course, it works together with your nutrients, your hormones, to simultaneously support good environment growth and establishment of healthier healing process in your body after stem cell treatment. So all these are the roles of regenerative medicine into diabetes treatment. Okay, so if you can practice, for example, intermittent fasting and ketogenic diet after stem cell treatment, yes, it may help your stem cell to work better. Okay, if you're also doing hormone optimization, whichever you need, okay, while doing stem cells, of course, your stem cell will have a better environment to survive and to show the function in the body. The efficacy will be stronger. So all these are very important and also determine the outcome of the stem cell treatment results. Okay, yes. So pancreas rejuvenation. Okay, that's almost coming to the end. How to treat diabetes with regenerative treatment actually is to rejuvenate the pancreas. Yeah, healing the diabetes is not curing. We are talking about healing. Of course, if your condition is mild, once you heal, it can reach a cure. If your diabetes is at a severe or advanced stage, when you heal the characters of your pancreas, yeah, you actually can lighten the severity of your diabetes. Okay, so by combining, okay, basically in regenerative medicine, these four pillars are our main important treatment. Yeah, not using medication. Okay, stem cells is to regenerate and heal the pancreas cells in your body. Okay, and then exosome is to speed up the healing process. Okay, by itself and also by combination with the stem cell. NK cell is to reduce inflammation characters in the body. Then it reduces the insulin resistance, reduces then the workload on your pancreas, and then it also helps your stem cells by giving a better environment to your stem cells to work after NK cell therapy. And of course, yeah, thyroid optimization and also some hormone optimization accordingly to your age and needs will also reduce, yeah, your body inflammation and visceral fat reduction, especially by thyroid optimization. That gives you a lesser inflammation response in the body. It gives you a lesser insulin resistant character or level in the body and reduces workload on your pancreas. Then simultaneously, when you heal your pancreas with stem cells and exosomes, okay, then your healing of diabetes by doing pancreas rejuvenation will slowly take place. Okay, so ladies and gentlemen, I hope this is almost coming to the end of our live talk today. Okay, I hope it's not too complicated. I try to make it simple and easy to understand. But this is a brief idea. If you do have a particular issue of diabetes with your problem in your health condition, and you wish and you want to know more, how this regenerative medicine helps you, okay, and how can you do, or what are the steps of treatment that you can do or you should do, okay, and what you should do first and what you should next, how to plan your protocol of treatment using regenerative medicine. Yes, you are welcome to contact us for in-person assessment and also consultation by calling us here 017-781-5237. You can also contact us through this phone by call or WhatsApp or even message us directly in our Facebook. Okay, you also can reach us through our website in www.revivalclinic.com.my. Okay, we're also available in Instagram and Facebook. Okay, so welcome everyone to call us for consultation if you have this problem of diabetes, regardless whether in the early stage, milder stage, or in the advanced or severe stage. If you're interested in regenerative medicine for the purpose to improve, okay, your diabetes by lightening or reducing the need of medication, or you want to be more confident, more effective to prevent the complication of diabetes, or if you want to prevent your diabetes from progressing further until you want to prevent using insulin, okay, in your diabetes. So what you can do, okay, yes, regenerative medicine is one of the way or options that you can also get to understand and to do, okay, to help you to heal and rejuvenate your pancreas. Okay, so ladies and gentlemen, today is our discussion here on diabetes. Okay, so I hope every one of you here have a good understanding afterward. And okay, until here lah. So thank you very much again to everyone. Thank you. And thanks again for everyone who asked question and joined us. All right. So I wish every one of you stay healthy, stay beauty. Okay. And I will see you again on next Wednesday is a public holiday in Malaysia, which is our Hari Raya. So we will stop one of our live session on next Wednesday, and I see you again on the coming next week. Okay, the next week Wednesday, same time 1 p.m. Okay, talking more about health, anti-aging, regenerative medicine, and of course aesthetic. Okay, so thanks again. I'm Dr. Jeff from Revival Clinic. Okay, thank you very much, and see you again. Have a nice day. Thank you.